Hello, and welcome to today's webinar presented by the Spartanburg School District Consortium and Connect. We will be talking about minors' rights and supporting youth in accessing sexual health services. Thank you for joining us. We have two main objectives for this webinar. The first is to summarize South Carolina laws regarding a minor's right to self-consent for sexual health services. And the second is to identify best practices to maintain student confidentiality related to sexual health services. I'd like to introduce today's speakers. My name is Lucy Wilms, and I'm the Adolescent Health Grant Manager for the Spartanburg School District Consortium. Our work is funded by a grant from the CDC's Division of Adolescent and School Health. We are joined by Polly Edwards-Pageant, who is the Director of Adolescent Health Initiative at the Mary Black Foundation, and she has been working with Connect for the last 5 years. We are also fortunate to have the support from a nonprofit organization in Washington, D.C. called Advocates for Youth. We are joined by Mary Beth Sidlowski, who is the Associate Director of Healthy and Supportive Schools, and we're supported by Caitlin Vicora, Program Coordinator for Healthy and Supportive Schools, and we'll hear from her next time. Advocates for Youth is one of the organizations that is helping us to achieve our goals of reducing teen pregnancy and STIs and HIV. As you can see in our program model, we have three components to our work. SHE, which stands for Sexual Health Education, SHS, which stands for Sexual Health Services, and SSE, which stands for Safe and Supportive Environments. These three components, we work to strengthen staff capacity, increase student access to programs and services, and engage our community partners. This work in our school system builds upon the success of the Connect initiative. What is Connect? Hopefully you know by now, but Connect is Spartanburg's adolescent health initiative in partnership with schools and community to improve youth outcomes for all adolescents. There are three areas, which include the medical, community, and schools, and three focuses, which include evidence-based policies, programs, and practices. The strategies include systems thinking, community engagement, and capacity building. Connect has identified 4 medical best practices that you should be aware of. The first is screening for reproductive and sexual health needs in primary care. The second is clear, consistent messages between school, the medical community, and the community on accessing care, so that everyone's receiving the same messages. The third is Title X and FQHC offering adolescent-friendly provisions of care, authentic referrals from school, community, and medical clinics. And lastly, increasing adolescent-friendly access points in rural areas. Before we jump into our information on minors' rights, we wanted to make sure that you were aware of some data that was that came recently from the Youth Behavior Risk Survey, which was administered to high school students in Spartanburg in the spring of 2019. This data includes some of the sexual health indicators from our students. We know that nearly 40% of students have ever had sex, and 27.4% of high school students are currently sexually active. 8.7 students reported having had sexual intercourse with 4 or more partners. And of those who are sexually active, 33.9% of students reported using birth control pills, birth control ring, IUD, or an implant to prevent pregnancy. And we know that nearly 10% of students who are sexually active used no method to prevent pregnancy at their last sexual contact. This information lets us know that nurses have a really unique opportunity to help students in seeking the care that they need. So, what are minors' rights? Minors' rights are the ability of people younger than 18, generally the legal definition of a minor, to consent to a range of sensitive healthcare services, including sexual and reproductive health care, mental health services, and alcohol and drug abuse treatment. What minors or young people under the age of 18 are able to access or receive for health services has been changing and increasing dramatically over the years. While the healthcare field recognizes that involving parents or guardians in young people's healthcare decisions is desirable, research has shown that young people will not seek services if they need to include or inform their parent. So there are no federal laws guiding the rights of minors. These are determined by states individually. However, there have been many Supreme Court cases and court cases that do help determine what states enact pertaining to a minor's ability to access certain medical care and supports without the involvement of parents. So we understand that laws vary state by state regarding minors' rights to confidential care, and state by state factors affecting rights include the legal definition of a minor, the conditions of legal emancipation, parental notification and consent requirements, and mandatory reporting requirements. Since laws can differ from state to state, it's important for nurses to be up to date on what health services and treatments a minor can obtain in their state and help educate young people and possibly their parents and trusted adults. This will help support young people in seeking out health care for themselves when otherwise they might not. The whole school, whole community, whole child model was developed in collaboration by educators and public health practitioners who many times are serving the same children in the same location and addressing the same related issues. These professionals have recognized the connection between health and academic achievement. A child who is not healthy may struggle in school. A child who struggles to maintain their education will struggle in being healthy now and in the future. By developing a model that does not divide the needs of a child, but addresses both health and education with a surrounding support system of community will help advance the well-being and education of students. One of the 10 components of the whole child model is health services, which supports the connection of school staff, students, families, and community and healthcare providers to promote the healthcare of students in a healthy and safe school environment. Helping young people know what services they can access can assist with early intervention of potential health problems, can support preventative care, and wellness promotion. Now we will take a look at some case scenarios which explain South Carolina's minor consent and confidentiality laws.
Thank you, Lucy. This is Polly Edwards-Paget, the Adolescent Health Project Director at the Mary Black Foundation. And let's look at some case scenarios. This is Shay. Shay is 15. She is here today because of a sore throat. During her visit, the provider finds out that Shay is concerned about having an STI. Shay says that she's worried her mother will kick her out of the house if she knows Shay is sexually active. Consider the answer to these questions quietly to yourself. Can the provider screen Shay for an STI without her mother's knowledge or permission and still follow consent laws? Why or why not? We see these scenarios play out in medical settings all the time. Today, we're going to talk more about these scenarios. Shay's scenario brings up another issue, which is how our own values might affect the way we feel about teens accessing certain services without their parents being aware. In Shay's situation, she is concerned about her mother, which may affect how we feel about getting STI testing without involving a parent. We usually do not have complete information about a patient. When we know more details, could it affect how we feel about the patient's right to confidentiality? Even if a teen can legally receive some services without a parent's consent, it can be challenging when we think parents should be involved. What can go wrong if we break confidentiality? The main point of understanding and breaking confidentiality is that if we don't protect confidentiality, it can have a negative impact on a teen. Many teens choose to include their parent or guardian in decisions about their health. For some teens, however, having the option of certain confidential services makes it more likely that they will seek care when they need it. Before we review the laws, it's important to recognize the difference between consent and confidentiality. Consent is permission to act. In general, a parent or legal guardian must give their permission or consent before their minor child can receive a medical service. However, there are important exceptions where a minor can consent to their own care without a parent's permission. We will discuss these exemptions today. Confidentiality refers to how healthcare providers and staff keep certain information private. Consent does not equal confidentiality. Even if a minor is allowed to consent to receive a service without a parent's permission, it does not mean that the provider is required to keep it confidential. So laws can protect a minor's right to access a specific service like STI testing without requiring parents' permission, but it's up to healthcare providers and staff to protect a minor's confidentiality. Now let's review the South Carolina laws in more depth. As this slide says, a parent or legal guardian must provide consent on behalf of a minor under the age of 18 before healthcare services are provided, with several important exceptions. These exceptions are based on a minor's status. This is independence from their parents or guardian, a minor's age, the type of service requested, such as certain sexual health services, or the funding stream, such as a DHEC clinic or Title X clinic. Again, these laws can sometimes be confusing, so I'm passing out, and I'm going to show you later on in the slideshow, some information about minors' rights that you can have in your school. Now let's take a look at the exemptions based on status. If a minor has any of these statuses, they can consent to healthcare services without a parent or guardian's permission if they are married or serving in the military or legally emancipated. Additionally, South Carolina has several laws that outline different healthcare services that minors can receive without their parents' or guardians' permission based on their specific age. Minors 16 or older can consent to any healthcare services that do not require an operation. Minors 16 or older may also consent to an operation if it is essential to their health or life in the opinion of the performing physician and a consultant physician if one is available. For example, a 16-year-old can consent for insertion of the contraceptive implant, such as the Nexplanon, but cannot consent to have it removed because removal is consideration of an operation or an invasive medical procedure. However, if the operation was deemed essential to their health or life by the performing physician, and ideally a consultant, the operation could be performed. Minors under 16 may consent to health services of any kind when in the judgment of a person authorized by law to render a particular health service, such as services that are deemed necessary. Additionally, if the minor is under 16 and the health services involve an operation, it can only be performed if it is essential to their health or life in the opinion of the performing physician and a consultant physician if one is available. As you can see, these laws allow for a broad exception for healthcare professionals to use their professional judgment. In these cases, it is advisable for the physician to consult another physician if one is available. Now let's look at the exemptions based on the type of service. Each state has certain services that a minor may consent to without a parent or guardian's consent. A parent may still find out about the service, so it may not actually be confidential, but it's important to note that legally a minor does not need a parent to consent to these services. 1, testing pregnancy testing and prenatal care other than abortion. 2, family planning and contraceptive care, including emergency contraception. 3, STI testing and treatment, although some STIs must be reported to the health department. 4, treatment for abuse of controlled substances or alcohol. 5, outpatient mental health services. And finally, emergency care if the proposed surgical or medical treatment is reasonably necessary according to competent medical judgment, a person authorized to consent is not readily available, and any delay in treatment would jeopardize the minor's life or health. Finally, let's look at exemptions based on funding source. Minors are able to receive confidential family planning services if the funding source is Medicaid or a Title X family planning program. Health centers that cannot provide confidential sexual health services to patients using private insurance can often provide more assurance of confidentiality to teens using Medicaid. It is also good to be aware of local Title X clinics, so a minor can be referred there if they need confidential health services. If your health center is funded through Title X, you can provide clearly all the reproductive health services to minors without a parent's consent. Title X funding in our community is located at the Department of Health and Environmental Control. Abortion is the exception, as it requires parental consent or judicial bypass. A healthcare provider who treats a minor ordinarily must not notify the minor's parent or guardian about the treatment without the minor's expressed permission. However, a healthcare provider must break confidentiality and make a report when there is reasonable belief that the minor has been or may be abused or neglected. The healthcare provider does not need to know for sure that the minor has been abused or neglected, but only that there is a reasonable belief. It is also important to note that the legal age of consent for sexual contact in South Carolina is 16. In addition, individuals as young as 14 years old are able to consent to sex with a partner who is 18 years old or younger. For example, if a 13-year-old student discloses that he was sexually active, the provider would be required to break confidentiality and report this abuse since 13-year-olds cannot legally consent for sexual contact.
Thanks, Polly, for taking us through all the laws pertaining to minors' rights in South Carolina. My name is Mary Beth, and I am from Advocates for Youth, and it's a pleasure to be with you today. I just wanted to provide a quick note about parents and guardians. Research does show that they can play a crucial role in their teenage children's decision-making and health. It can be tricky, however, to keep parents engaged. And at the same time, it's essential to provide the opportunity for adolescents to talk to a provider alone and to provide confidential services where possible. So now that we've reviewed the laws, let's take a look at another scenario. This is Giovanni, a 17-year-old boy who has come to the office for a well visit. While there, he states to you that he's ready to get treatment for alcohol abuse, but he really doesn't want to disappoint his parents, and thus he doesn't want to tell his parents. In this situation, is Giovanni allowed to get outpatient counseling for substance abuse without a parent's consent? Thinking back to what was shared about South Carolina laws, yes, Giovanni does have the ability to go get outpatient counseling for substance abuse. And the provider does not need to tell Giovanni's parents that he is seeking this care, but the provider may encourage Giovanni to tell his parents. Let's wrap up by going back to our 15-year-old patient scenario, Shay, whom we met earlier. Let's look at the questions and try to answer them together. Remember, she had a sore throat, she was concerned about having an STI, and she was worried that her mother would kick her out of the house if she knew that Shay was sexually active. So, can Shay receive STI testing without a parent's permission? Yes, Shay can be tested for chlamydia without parental consent. Can she also receive STI treatment? Yes, she can. And can the provider talk to Shay's mother without Shay's consent? Yes, the provider can tell her mother that Shay received the services. However, Shay may be less likely to seek out care if she is worried her confidentiality may not be maintained. And in this case, there are many other negative consequences of involving the parent. As we talked about at the beginning, there are different perspectives and feelings about how parents shouldn't be involved in their teens' healthcare. It can be helpful to consider how each of our own feelings affects the care that we may provide. So after we've talked about now the South Carolina minors' rights laws and when the confidentiality of a visit might have to be broken, let's take a moment to review some reasons why healthcare providers, including nurses, should make efforts to provide confidential care to young people. We're going to take a look at 3 factors, those being clinically essential, developmentally expected, and supported by expert consensus. Several studies support the rationale for confidentiality in adolescent medicine and demonstrate that confidentiality is clinically essential in an adolescent's decision to seek care, in their decision to disclose any behaviors they might be engaging in, and if they will seek follow-up care. Adolescents demonstrate an increasing need for autonomy. The adolescent stage of development is characterized as a transition between the dependence of childhood to the independence of adulthood. This process does not occur overnight. Additionally, adolescents have been shown to have increasing intellectual capacity to give informed consent. Many studies have demonstrated that by age 14, most adolescents possess adult decision-making capacity. Thus, they are in a position to want to take the opportunity and have more responsibility for their own health. And finally, organizations such as the American College of Obstetricians and Gynecologists, the Society for Adolescent Health and Medicine, the American Medical Association, the American Public Health Association, and the American Academy of Pediatrics have reached consensus that adolescent health care should be confidential. However, they do want to encourage young people to discuss and include their parents when addressing their health. There are some laws that are available to assist nurses and other medical providers that support the privacy of a minor's medical records. The first is the Health Insurance Portability and Accountability Act, or HIPAA. Generally, this does allow a parent to have access to their child's medical records when they're under the age of 18, with 3 exceptions. And this is when a minor obtains care at the direction of a court, when a parent agrees that the clinician and minor can have a confidential relationship, and when a minor has consented for the care and the consent of the parent is not required by state or other applicable law. The second law is the Family Educational Rights and Privacy Act, or FERPA, and this allows parents to access a minor's educational records, which may contain some health information. However, if health records are kept separately, such as at a school-based health center where confidentiality has been addressed, these records would be subject to the HIPAA provisions that we just reviewed. But there are some important questions and when looking at the HIPAA and FERPA, and interpretation do arise when healthcare is delivered in a school-based health clinic by a school nurse or by a professional who is working in the school that has extensive communication about a student's health. In any specific situation, determining whether the relevant information and records are covered by FERPA or the HIPAA privacy rule requires careful analysis, And we do encourage nurses, if they have any questions, to seek out support from their supervisor and or legal support that's provided to the school district. Now that we've reviewed a few reasons for why it's important to provide confidential care and the laws that address privacy information, we want to encourage you to utilize the following tips and guidance that do support the provision of confidential care. Clearly communicate your state laws or policies pertaining to confidentiality. Young people need to be aware of what confidentiality options they have. Having clear information about your state's laws that governs the right of adolescent patients to confidentiality and to consent to care or treatment. This information should be posted and visible to your students wherever you are providing health-related care. You also want to consider having these policies as a handout and to be verbally communicating this to your students as you begin each visit with them. On the screen, you will see an example of a policy on confidentiality from the URMC Department of Pediatrics. So plainly describing what the confidentiality visit will look like when that young person is receiving care from you, and those reasons for why confidentiality might have to be broken. And here is an example of South Carolina's Teen Bill of Rights. And this is something that you will have access to and can have access to off of the Connect website that reviews the policies around confidentiality and the supports that young people have when accessing medical care. Some additional information that we would want you to know and to be able to share with students who visit you is that their health information cannot be shared with anyone, including parents or guardians, without their written permission, unless required by law, or if there is concern that the young person might harm themselves or someone else. Additionally, that their health information that they disclose with you during the visit is confidential and it is consistent with the South Carolina state laws and regulations. And while we understand that a school nurse should not be in a position to be billing a young person, young people might need to be provided a referral to receive health services at a clinic, a hospital, or other place that provide cares that they might need to be billed. Billing procedures should attempt to maintain the student's confidentiality. If this is not possible, the provider or the billing staff do need to advise the student about the potential breach of confidentiality and provide them with options. And also, please don't forget that you can always refer a student for appropriate health services if you feel that you might not be able to provide confidential care. So let's review. Hopefully by this point, you will have been able to become familiar with the state laws and be able to summarize them regarding a minor's right to self-consent for sexual health services. Also, to be able to identify best practices to maintain student confidentiality related to sexual health services. And again, this has been a lot of information, and we will have some additional handouts that will be available with this webinar that supports your ability to continue to review the minor's rights. So some next steps that you can take after this webinar. Definitely, again, review those South Carolina's laws on minors' rights, and also share any information that you've learned and also any information you have about local policy pertaining to minors' rights with the leadership at your school so that you might receive support and help everyone be educated on the rights of young people. If you have any follow-up questions that you might like to have answered, please visit the Village Legal Hub. Andrea Moore, and her contact information is here, would be a definite great resource to support you on answering specific questions that you have. Continue to review those tips for providing confidential services And we will also be having additional forthcoming webinars that support youth-friendly services that also support confidential services, so that you can definitely prepare and be ready to provide confidential services to your students when you're back in the building with them.
And before we close today, we want to make sure that you are aware of the resources available in our community to support you. Make sure that you go to connectspartanburg.org to review the online resource guide for teens, parents, and partners in Spartanburg. We want to make sure that you're aware that there are 2 teen clinics in Spartanburg, the Point at Tobias and Regenesis Teen Health Services, where teens can receive confidential sexual health care services. We also do have a community health worker through iMatter. Her name is Shell Jones, and she is someone who is really available to provide referrals and sexual health information to students if you feel that's something that you would prefer someone else do with your students and your youth. We also have materials for your offices, posters, minors' rights, and sexual health cards. If you would be interested in receiving those materials, please contact me. And we recommend that you post the PSA materials in visible areas in your offices. And we know that that school nurses may be some of the only healthcare that our older students receive all year long. So we are really grateful for your partnership in providing confidential healthcare services for our youth. So thank you so much for your time and attention. Here's my contact information. And you see the QR code at the bottom of your screen. We would ask that you complete a really brief evaluation to let us know what you think of this webinar. If you pull up the camera feature on your phone and hover it over the QR code, you'll see that a link will pop up. Just click that link and it'll direct you to the survey. Once again, thank you so much for your time and attention, and we look forward to talking to you again soon.